Welcome to AI Dispatch, your channel for the latest AI videos on YouTube. If you don't want to miss these updates, please like, subscribe, and share. Stanford cardiologist Mike McConnell delivers a stark warning. Your clean stress test result guarantees nothing about your heart attack risk tomorrow. His argument dismantles the diagnostic framework physicians have relied on for decades. He contends that retinal scans reveal cardiovascular decay invisible to chest examinations and that preventative cardiology must adopt oncology's aggressive screening protocols. These positions challenge both medical practice and institutional incentives. Mike McConnell serves as professor of cardiology at Stanford University, where his research centers on AI-driven cardiovascular detection systems. His tenure at Google produced breakthrough work demonstrating that retinal imaging could predict heart disease with accuracy exceeding human specialists. As author of Fight Heart Disease Like Cancer, he advocates restructuring cardiac care around early intervention rather than symptom management. Passing a cardiac stress test offers zero protection against sudden death from myocardial infarction the following day. This claim violates medical common sense. Yet McConnell presents mechanical reasoning that exposes the test's fundamental limitation. Stress tests identify only severe arterial blockages exceeding 70% obstruction. The diagnostic assumption treats blood flow as the critical variable. McConnell's counterargument targets the actual pathology of most heart attacks. They originate not from gradually narrowing vessels, but from sudden rupture of small, non-obstructive plaques that trigger acute clot formation. A patient demonstrating normal exercise capacity on Tuesday possesses adequate blood flow at that moment. When a minor plaque ruptures Wednesday, forming an instant occlusion, the prior test becomes irrelevant. The reliance on stress testing creates false security rather than genuine risk assessment. McConnell's motivation for challenging this orthodoxy stems from personal loss. Watching family members affected by heart disease convinced him the medical establishment applied the wrong treatment model. His book emerged from the conviction that prevention alone fails without the aggressive early screening oncology employs. The location for detecting cardiovascular pathology inverts conventional anatomical logic. Rather than examining the chest, McConnell directs attention to the eye. His work at Google produced research demonstrating that artificial intelligence analyzing retinal photographs could assess cardiovascular risk with remarkable precision. The finding that shocked ophthalmology. The AI achieved over 90% accuracy, identifying patient sex from retinal images alone, a task experienced ophthalmologists cannot reliably perform. Human specialists examining retinas their entire careers cannot extract the information the AI detects. The eye functions as a direct window into the body's microvascular architecture. While physicians observe an optic nerve, the algorithm identifies microscopic vascular changes, venous dilation, arterial narrowing, signaling, systemic deterioration, long preceding clinical symptoms. The retina reveals pathology, the stethoscope misses entirely. The treatment timeline for cardiac disease requires complete restructuring. Standard protocol manages heart disease as a chronic condition requiring lifelong monitoring. McConnell proposes adopting oncology's framework instead. Cancer treatment doesn't wait for tumours to produce pain before intervening. Screening begins early, targeting remission as the goal. McConnell cites statistics revealing that by age 50, 1 in 3 men already has arterial calcium deposits. Women reach this threshold at 60. Patients experiencing chest pain have reached advanced disease. After 2 decades assessing patients, McConnell jokes he still lacks X-ray vision. He cannot determine by observation whether dangerous calcium buildup exists. Objective testing must replace clinical intuition. The claim regarding reversibility challenges long-standing medical doctrine. Plaque accumulation has been considered irreversible, progressive deterioration. McConnell highlights emerging drug classes, specifically PCSK9 inhibitors and potential gene therapies, capable of reducing cholesterol to levels where dangerous soft plaque, the rupture-prone variety, actually regresses. Heart disease transforms from inevitable decline into a correctable biological error. Responsibility for cardiac health detection is shifting from physicians to automated systems. The assumption that doctors will identify illness when it emerges no longer holds. McConnell suggests smartphones will detect disease before physicians do, with the medical system becoming the constraint rather than the solution. Opportunistic imaging describes AI analysing scans ordered for unrelated conditions, pneumonia, for example, and incidentally discovering early cardiac pathology. A Stanford study showed this automated secondary analysis initiated life-saving preventative therapy for 50% of flagged patients within 6 months. When McConnell first proposed early cardiac detection at a cardiology conference, colleagues objected that they were already overwhelmed. He found this response unacceptable, arguing that workload doesn't excuse failing to inform patients of identified risk. This resistance reveals the core friction. When AI flags asymptomatic patients, the medical infrastructure designed for acute crises cannot absorb the volume. McConnell envisions direct-to-consumer AI functioning as a preventative cardiologist accessible via phone, analysing medical records and wearables to catch prediabetes or kidney dysfunction that overextended primary care physicians miss. The technology for early detection exists. Biological interventions are emerging. The delivery system remains broken. If the medical establishment stays too busy to treat the asymptomatic patients AI identifies, we construct the most sophisticated alarm with no one available to respond. Asked which discipline he would pursue if restarting his career, McConnell identified implementation science, the field determining how proven medical advances actually reach patients. He considers it healthcare's largest bottleneck, the defining challenge for translating discovery into impact. If you're interested in the video featured in this episode, click the link below to watch the original.